Hello, my name is Jonna.
Hi, I'm Kevin. This is our healthy daughter, Casey, and our beautiful autistic son, Kevin.
Kevin is 3 years and 1 month old. Kevin was diagnosed with severe autism with regression at the age of 23 months. Since that, it's been a long road, and we're here today. Kevin has been given the methyl B12 shots starting January 3rd was his first shot. For 5 solid weeks, we did nothing else but the shots, just to basically see how he did respond, if he responded at all. I today want to show you basically how we administer the shots, how we do it, and I also want to show you some examples of how easy it is versus the typical supplements through oral. This is a little bit different for us. I administer the shots, and I want to tell you first of all that I have a phobia of needles, or did have a phobia of needles. These needles, and I'm going to show you right now. When we found out, first of all, that we would have to start administering the shots with Dr. Neubrander,
We were very uncomfortable with that.
we were a little bit. We were scared because we didn't have my phobia, of course, of needles, and because of the lack of knowledge we had dealing with needles. When they came, I think this is the first thing that made me feel so better, was the actual thickness and size of it. I knew no matter how I put that in my child, I would not hurt him.
Also, we administer the shot at night while he's sleeping.
We basically take this cream that Dr. Neubrander had prescribed, which I thought was great. It eased us, and I knew it would numb the area. I basically take a little bit of cream, I guess like a pea size, like this, and I take it, and I alternate, left cheek, right cheek. I do every 3 nights he has a shot of methyl B12. I'll put this on the outer tip, outer quadrant, upper outer quadrant of him, and then I put a Band-Aid over it, just so I know the area where I have actually put this numbing cream on him, to assure myself that it won't hurt him. We wait 45 minutes to an hour, and then we go upstairs. We've always done this before at night when he's asleep. The child does not flinch. We pull his vapor down, Kevin will hold his vapor down, my husband, and then I will go in with the needle in the subcutaneous fat at an angle, put the needle in, which takes a matter of, I would say, 2 seconds, and he literally does not flinch. And I think after the first time I administered the needle, realizing that he didn't even move in his sleep, yet alone cry, I was okay with it.
The whole procedure takes about 3 minutes. We literally, when we get kids to bed and we have a little bit of time to relax, we'll be watching a TV show, commercial time, shot time, boom.
It's done.
Up. We go up, quite frankly, we don't even turn the light on. We use a small flashlight. I turn the Band-Aid back, John administers the shot, and pull up his diaper and we're good to go. So this is something where we do not in any way want to hurt our child whatsoever. We're very comfortable with it, and once again, I think after we got over the first night, it was very easy to do. And right now, we're actually going to give Kevin a shot for the first time, methyl B12 shot while he's awake.
First time for us too.
First time for us too.
And I'm comfortable in doing this because I want to show everybody, I guess myself, how much I know it won't hurt him. And then after the methyl B12 shot, I want to show you how we're going to give him something oral. So we're going to get him right now. Basically all I do, I have a coffee can, I put a hole that's very tightly tighted or taped, and I have a hole where I administer the needles. I basically get an alcohol swab, soak the whole one side. Generally speaking, Kevin will go up. I have the cream on. And I want to show you the Band-Aid right there. Basically, before I do it, I peel the Band-Aid away where I see I've administered the cream. I wipe with the alcohol, and then I get ready to administer the shot. Pull the Band-Aid off to where I see the cream is. I go in on the angle, give him a shot, pull it out. That's it.
Clean it off.
I clean him off again, just to make sure for myself.
That's it.
And that's it. The child did not feel that whatsoever. And that's awake. And that was my first time administering it awake with the phobia of needles. I now want to show you administering oral supplements that are supposed to be very easy.
Which is a nightmare for us.
Which is a nightmare. Last night my son kicked me in my neck because he doesn't like the taste and hates it so much, and we just saw the difference there. I basically put the cream back in the fridge and put this all in a locked cabinet so no one can get it.
Kevin, do you say hi? Say hi. Since we've been administering the shots to Kevin, Kevin has been much more alert, more focused. He now realizes he has a sister, which makes his sister very happy. They play together, and he's not verbal yet, but he does a lot of babbling, and he's learning to say things, to count to 10 and things like that. So
before Kevin, we started the Methyl B12 shots, Kevin might say 2 words, Jew and more, maybe if we were lucky. Kevin right now can count up to 10. He can sing 4 or 5 songs staring directly at me, which is so nice because we do things together.
With prompting.
With prompting. He will sing with me. I think the biggest changes that we've seen in Kevin is that he is alert now. Before, I don't think
he's more tolerant of other people. And a big thing that's happened in the last couple of weeks is we were able to put him into a school with other mainstream kids.
Typical.
And he actually went in and was not going to sit in the corner. He interacted. He played Ring Around the Rosie with the other kids. And he, as a matter of fact, he made play as to pretend to drink out of a cup like they were sharing a drink, which was kind of neat. The other thing last night, as I was giving Kevin a bath, I put the numbers 1 through 10 on the side of the tub. And I did count them out first about 3 or 4 times, but really got away from it. And then all of a sudden, out of the blue, I was doing something else in the bathroom. Next thing you know, he did point to, without prompting, he pointed to each number. 1, 2, 3, 4, and so on. We always have him count to 10. I only had 9 numbers, and he did stop at 9. And having an autistic child, we were a little bit amazed by it, and it was a good feeling. And what we're seeing with all that we've been doing now for the last, say, 5 to 6 weeks is a lack of regression. We feel like we're moving forward slowly, but it's a good feeling.
The regression has stopped for the first time, and we are seeing a positive way up that ladder slowly. Kevin, now his therapist, he has 4 or 5 different therapists. He has an occupational therapist, a speech therapist, and 3 Lobos ABA therapists. And all of them, especially his ABA therapist, cannot believe how long and how he can sit at a table and learn, and how focused he is, and how quick he's mastering his at levels that he could not master before. Basically because he's comfortable in his own skin. He's sitting longer. He's more focused. Even within the house, there are things that I see him looking at that he didn't even know existed before, yet alone to concentrate on them, such as pictures of family members.
Yes.
He says hi now to every single person that walks in this door, with my prompting or without my prompting, and will say goodbye. He's not as rigid or scared of change. He is playing. He will sit with his daughter and play. And we did the Methyl B12 shots, his daughter. We did the Methyl B12 shots, as I said, I think before, by themselves for 5 weeks, because we wanted to see if he was a responder. And he was. And it's not in the way like, oh, my son is cured, but it's in all the ways that I would want to see a beginning of the next step. As in focus, as in verbal with imitation, speaking clearer, more articulate. The eye contact has improved by 90%.
We feel like he has a chance, whereas you can honestly say 3 months ago we thought we don't have a chance. And we're a family, we're a tight-knit family, we try to work with one another. And autism, as you know, it's been very hard. But since we've met Dr. Neubrander, we started administering the shots and we're moving forward. We feel as though we have hope, and we have a chance, and that's what's most important.
Hey, Kevin. This is you just saw the Methyl B12 shot. This is a supplement that tastes like cherry.
Come on, Gabby.
That really tastes good. And I want you to see the traumatic part of it for me and my son.
Come here, Gabby. Gabby.
Just a little bit.
A little bit. Good boy. It's okay. You're okay. You're okay. You're okay. You're okay. You're okay. It's okay. It's all right. It's okay. It's all right. All right, whole chocolate's all over. Yeah. All right. Okay. All right. It's all right. It's all right. Gabby.
I'm going to do that now because I think we're showing that. And And I got no medicine in him.
Come on. It's all right. You're okay.
Supplements
You're okay.
didn't work.
You're
I think
okay.
the biggest thing is oral versus
It's all right.
every
It's all right. It's all right.
If you kindly or easily get it in your child, there's no guarantees.
Give me a hug. Give me a hug. It's all right.
And second of all, how much he
It's all
actually does take and keep in.
It's all right. Hey, you're okay. You're
Three-quarters of
okay.
his supplement.
It's all
I
done.
would say
It's
maybe-
all done. We're not going to do it anymore. It's all
I don't
done.
even know if any of it was adjusted.
Okay. Are you okay?
And that was actually easier.
Are you
Last night
okay?
he kicked me in my neck just because
Are you
he called
okay?
me down. So this is the
Okay.
difference
Yeah.
between a simple supplement, polybiflor, any kind of medication that is prescribed daily for your child, or vitamin, versus the methylated B12 shot.
All right.
So hopefully that shows you everything that we go through on a daily basis, and the severity of it and the non-severity of it, and what we are comfortable with and what's easy and what's not easy.
And what I can say is that of all the things we've done,
Come here.
I think the shot's been the easiest thing that we do. That's our least concern. It's trying to give things orally is very,
And I
very
can
hard.
honestly say the thing that we've seen the most, I would say we've seen an improvement on too. It's probably the easiest thing to administer, and something that we've seen a difference on all different levels. I want to count. Can you count with me?
Count with
Here,
Mom.
look.
One.
Here, look. 1,
Oh, you're upset. You're upset. You're upset.
What are you
It's all
upset
right.
about? Do you want a cookie? Would you like, Kevin, would you like a cookie? Say cookie. Say cookie. Say cookie. There you go. Say cookie. Thank you. All right.
Okay.
And now he's upset now because
of
he sees there's more to go. And he's not done. I mean, to be honest, don't ever see that kind of response. Well, first of all, he's usually asleep, which is even easier to administer. But because I am so comfortable with the methyl B12 administration, I wanted to show you awake how easy and simple it can be with a child who has autism that doesn't stay still and is very strong. And you saw the difference from something that's oral and easy versus an intravenous or a shot. I basically want to finish off by saying, from my heart as a parent, I would never sit here and tell anybody something, first of all, that I didn't
research.
We've
done a ton of research.
believe in
on it.
myself. I'm not sitting here saying this is a possibility or this is something that might work. Like my husband
it might
said
work,
before, this is something that is
It's
working.
working. Yeah.
He's not cured by any means.
But if
Like
we're
for
only
the
in the
first time we
initial stage.
stopped seeing, I mean, he's only been doing his first methyl B12 shot was January 3rd. For the first time we've stopped seeing the regression, which is so nice as a family. And to see progression in every single way, from play to affection to eye contact to awareness to things that I never thought he would be interested in before that he now is interested in, which is really cool. He plays with his sister now, and she's a child that constantly played with him and played with him and played with him, waiting for a day that he would look at her or handle her presence near him, and
Now he does.
He does. I never ever thought my child would walk into a typical mainstream preschool classroom, see the 4 corners where there were 4 corners of toys, and walk to the one corner where there were 6 boys, and go up there and say hi and play. And he played. His biggest fear are children that are his same age, because the age that he's in, he knows that's the age where they are the most unpredictable. You don't know if they're going to come in your space, touch you, pull you, cry, or whatever. And he thinks it's cool to be with kids now and like kids. I'm noticing that he's not fighting us, which makes our everyday life a little bit easier because he doesn't fight us on his rigidness and his routine. He's allowing the routine to be broken a little bit now.
We got him a new bed the other night. He went from a little boy bed to a big bed,
And he knew he
you
had a
could
new
see
bed.
that he knew that he had that, I guess, that rite of passage, if you will, and he knew there was something good going on, and he expressed his happiness. We could see it in his face and his reaction. The other thing too is last night we took away his pacifier, which was anytime he walked into his bedroom, he had in his mouth. Anytime he went into his room, Kevin has pacifier. We took it away last night without a fight.
As simple as you telling him.
And he asked me for it, and I said, all gone, and he was cool with it, and he had a great sleep, and
So it wasn't an issue.
we're
Which
kind
is a
of
pretty cool
moving
thing.
forward. That's what's most important.